Thank you, sir. Good morning, ladies and gentlemen. Dr. P. Shiva Reddy was an icon of Indian ophthalmology, and I had the great privilege of being with him from 91 onwards. He was very benevolent, always very loving, and he encouraged me a lot, and it's a great humbling but thrilling experience that I'm giving this ovation in his name. So we are in the session for controversies, and the controversy is why ROP. And why should we worry about ROP? It seems that this disease has to be tackled by Dr. Subhadra, Dr. Azad, Dr. Dota, but that's not true. I think all of us here in the audience are going to be touched by ROP in our own families, with our own children. I have seen ophthalmologist children becoming blind because of ROP, because they did not know that their child needs screening. So I think it's a disease which will touch all of us in our homes, and it's very close to us. And the reason why we should worry about ROP is because it's a rare situation where the child is in the hospital and is born with a normal macula, as you see here. Every preterm baby has a normal eye at birth, and it's so rare that you have a disease where the disease starts while the baby is in the hospital. So you can actually go to the hospital. You don't have to do door-to-door survey to search these patients. They're already admitted. They are motivated parents. You need to go to that hospital and you can examine these babies and find out that they're having some problem, and you can detect it on time and prevent this needless blindness, which has now become an epidemic in our country. So India, is a large country with varying levels of neonatal care. We are not highest manufacturer of anything except children. We have the highest number of children born in our country, more than 30 million now, and we also had the dubious distinction of having the largest neonatal deaths anywhere in the world, many more deaths than what happens in Africa or Bangladesh. So the Indian government and the NGOs and the WHO and the IPB, so many agencies are now fighting to save India's newborns. And very quickly we are going to save these precious babies who are low birth weight and preterm. And so that is the reason why this epidemic has come to us. The technological advances in neonatal care means that very small babies are being spared. They are being saved by great work done by neonatologists, and the parents want to have a bundle of joy. And the child was born without any disease, and it is a very sad situation that the child becomes blind within 3-4 months of birth and has a lifetime of blindness. And I come from Hyderabad, which is another Shahr in Mohabbat, just like Agra. There's a fast-paced development, and these babies are in the lanes and bylanes of this rapidly developing city, and our challenge is to reach the baby on time. So I'm going to just share some of the experiences that we had. We did not see ROP in our hospital. We started in 87 till 97. That means it was not a disease existing in my city, just as it would not be in many of your cities. But the moment the city starts developing, you can see that our graph, the neonatal mortality comes down, the number of NICUs, infertility clinics goes up, and there we have ROP blind babies. In 98, we had 12 blind babies who came to us at 7 months of age. And that is the time we decided that we are not going to allow this blindness to cover our city. So our program was for the whole city. We did not want to see blind babies. There is not only problem of the increase in numbers, but also varying neonatal care. So these cares which are given allow the baby to survive, but because of unwanted oxygen or poor care, they get a lot of morbidity, which includes the ROP. So we have to plan for the city and take care of all babies, whether they are in the government sector, private sector, tertiary care or secondary care. So I think we need to have India-specific issues. We've seen our own ragas, and we had the gravity study data there, but our terminology may be different. For example, this is our hot spice girl. So what we wanted to do was to have conditions which meet our terminology, which meet our patients, because our mothers will not know their last menstrual data. To have screening guidelines which says that screen at 21 weeks or 32 weeks is not going to work in our country. So we have worked very, very hard over the last 15 years to have national guidelines which are specific for India. We are very proud of it that these guidelines were made. This is very unprecedented in any other branch that we would work with two different societies and come up with India national guidelines, which is what everybody should follow. So when to screen is the most important slogan we gave from Hyderabad, that we have to screen this baby by day 30 of life. If you are sleeping in this lecture, just remember this one thing for your life, that your baby, your neighbor's baby, your grandson, granddaughter, anybody who is preterm needs to be screened within 30 days of life. Don't cross that deadline, because that is the most important way of ensuring that the child doesn't become blind. We are very good at preserving our things. We don't let our things go away. And same way we don't want this macula to go away with which the child was born. The ROP progresses slowly over a period of 2 to 3 weeks. So we have a window of opportunity to catch it the moment we start dilating vessels. So to screen for ROP, you don't have to learn any different technique or a difficult surgery. You don't need a big theatre like LASIK theatre or paper machine. You just need to do a fundoscopy and look at the retinal vessels. And anybody can check that these vessels are abnormal, and that's what is ROP. So it's not difficult for anybody to have a couple of weeks of training and pick up ROP. So you can see that the treatment is very effective. The moment you treat within 3 to 5 days, there's a rapid reduction of the disease, and so it's a very effective treatment. We are now going into era of anti-VEGF, but laser remains the mainstay of treatment. But whatever it is, it works best within 30 to 40 days of life. If you miss that boat, this is what will happen. Very soon the child will develop leukocoria, will be diagnosed by somebody as cataract or PHPV, but this is all ROP blindness and there's no cure for it. So the most important thing I want to tell is about the dilating drops. Give away atropine, no atropine for premature babies. You have to use dilute phenylephrine and tropicamide. The pupil dilates absolutely well. You wrap the baby, feed it, keep it warm, and you can just do fundoscopy. They're very, very cooperative patients. You don't need to worry that it's such a small baby, how will I hold it? You can just hold it, it just follows what you ask it to tell. And we move to screen. So again, the screening guidelines are very specific for India and for developing countries. We must screen any baby who is less than 2 kg or any preterm babies whose gestation age is not well known, which is very common in our country. So even if you have little suspicion, don't worry, even 3 kg baby can get ROP if it was preterm. So if it is a preterm baby, it is an NICU graduate, irrespective of whether it received oxygen or not, we must screen these babies. And the reason for this criteria is that you can see in the West, very small babies get ROP, big babies don't. But here we have data from the developed countries, including Hyderabad, Delhi, and Madras, in this paper by Claire Gilbert, which shows that even up to 2.5 or 3 kg baby, even 34-35 week baby gets ROP. So if you don't remember the criteria, don't worry. Just say anybody who was an NICU needs an evaluation. This is our 10-year data which shows that the ROP is a reality and a large number of babies do get very severe ROP, and so a universal screening has to be done. What worries us is that this is the data over 10 years. We show that we want to see how many doctors are following this day 30 strategy. For the last 15 years I have been shouting from podiums that please follow the day 30 strategy. We find that in tertiary care centers about 77 to 80% compliance is there. We want to see 95% to 99%. But in the rural areas and the districts where the disease is now spreading, the awareness is less and there are no strict guidelines. The following, so the compliance is less than 30 to 40%, and that's where we are getting our blind babies now. So why are the patients coming after day 30? So we found that the maximum reason was that in the discharge something, the doctor has not informed the parents that eye checkup is required, and that was a major cause. There were other less common causes like the ophthalmologist were on leave and was not there to check. But the most important cause was either the parents were not aware about the seriousness of the issue. They were just told like, go and get your eye checkup done at some point of time. So it has to be very strict, very specific, and this is good part of the national guideline. So our 10-year trend analysis shows that we are now getting inoperable cases from the districts, and this is our 10,000 baby came from Kakinada, government SMCU. Beautiful work done by the nurses and the doctors in the situation where now you see these SMCUs have been set up, big incubators, less staff, but the babies are surviving, and cute babies, and then they come to leukocoria at 3 months. This is the tragedy. We operated this child, fortunately she's got back vision, but this is what we are now doing. You see, I'm going to all these centers, talking to the administrators, talking to the nurses there, telling them about ROP and making sure that it's improving. And day by day we are seeing now babies coming earlier to us. So that is the mission, that is the place where it's going to work in Sholapur, in Nanded, in smaller towns, Kakinada. That is where this ROP is now developing. So we are not world champions in cricket. We are doing very bad today. But we have been and will always be the world champions in Kho-Kho, because that is our game. I'm sure most of you have played Kho-Kho. So I think India, with the largest number of babies in the world, should be dictating, should be telling, should be teaching people how to do the screening, how to take care of this large number of babies across the continent. Together, we all can win. This Kho-Kho game cannot be won if you are the fastest, if you are the smartest, but it can be won if you do a teamwork. So that is what we are attempting always to do, teamwork. And does it have an impact? Very rapidly when you start this screening program in any place, you see the blindness going down very quickly. And then you can screen that there's no ROP partnerships, and it always works. You can see here in our city of Hyderabad and Secunderabad, we're very proud that in 10 years now we have eliminated unscreened ROP blindness. We don't see state 5 ROP in our city at all. We have a city-wide very strict protocol, we audit it, we survey it, and if anybody defaults, a big letter goes to them and we go to the root cause why the baby fell through. So we need to move from the journals to the cribs. All the information is there in the journal, has to come to cribs. So we train many people and we are open to training. We have a 1-month hands-on training program, and a unique training program anywhere in the world, where we give hands-on training both in the MSU and for lasers, and we want all these gaps where there are no trainings to be there. So I think my message to you is that ROP is a disease which goes from sight to blindness, and we have an opportunity to prevent this needless blindness. And I urge anybody who sees unscreened stage 5 ROP to write letter to the NSU, so that the next baby doesn't come back from the same NSU in the same condition. And it makes a difference. And people are thankful for receiving those letters. It's painful for the person who receives the letter, but it's a good learning lesson. So it's a race against time. We have to have the nurses, obstetrician, neonatologists and ophthalmologists, and no ROP partnership. The baby has to be the center of this thing. We have to make sure that the red reflex the baby was born with doesn't become white, and this can be very, very well achieved by a tight network around the baby. So my slogan is East in Roshni Day, 30 days to light, and that is what I want everybody to know and follow. So मैं अकेला ही चला था जाने की मंजिल, लोग मिलते गए, कारवां जैसा गया. I started alone, but today in my city we have at least 30 people who are screening, and every MSU is covered, and I'm sure that this can be done by all of you sitting here and all of us together, and then we can have these beautiful babies who are preterm, who have fought against death, but they always have a preserved normal macula. So please say these things. Thank you.